Hi, I'm Ann Horinucci. I have a doctorate in physical therapy and worked as an engineer at Intel for 10 years. I love S3 Balance because it helps older adults fulfill their potential to lead more active and full lives. Tell us how you came up with the idea for S3 Balance.
Actually, it came up in school. Like many of us going through school, it was my first master's degree, and I was learning about balance control at the University of Oregon, poring over research, and I was trying to find ways to apply what I was learning. Always passionate about working with older adults, and I had a vision, and it was S3. 20 years later, a lot of research, talking to peers, testing, working with Ann, finding out what works, what doesn't, and still learning what works, what doesn't. But I think we have something that is really going to dramatically change how we treat older adults and how we view older adults and how we age. That is the message of S3 Balance.
Anyone able to stand is appropriate for S3 Balance. It is ideal for people who need assistive devices for gait, have multi-directional instability, low self-confidence, anxiety, cognitive impairments, or bedside needs.
Just standing up carries a whole multitude of health benefits, okay? Let's start at the ankle. Gravity is trying to make the ankle fall into dorsiflexion. So the calf has to work with the tibialis anterior to prevent that. The knee also wants to buckle. So the quad works with the hamstring to prevent knee buckling. Working up to the hip wants to buckle as well. So the glutes have to work with the front part of the hip, or the iliopsoas group, to prevent that buckling. And then all the way up the spine. The spine, the entire trunk, and even the neck have to work to prevent that buckling, right? So just in standing, you get a compression of bones, right? The compression of bones helps with osteoporosis. Just standing up increases metabolic demand as high as 300 to 400%. So she has her hands in safe position, right? Janet, go ahead and put your feet shoulder width. Great. Janet's gonna squat down just a little bit. Janet, go ahead and squat down just a little bit. Keep looking straight. Stop there. That's about 20 degrees of knee bend, not much. But the work of the quads, the calves, the hamstrings, the glutes, even her back, they're working, right? They're working. Now, if I want to make this harder, I'm not going to mess with the grip yet because I see that Janet's kind of bent over. So Janet, can you just make yourself more? Yeah. Now we're going to take this up a notch. We're going to make the muscles work harder right off the bat. Janet, go ahead and just put one foot up here. Nice job. Good. Now what did I just do? I just doubled the work of the muscles on the left side. So the thigh, the hamstrings, the hip, the calf muscles, as well as her trunk muscles, her back muscles, they all have to work harder now to stabilize. Now the tendency here is for her pelvis to drop to this side. Don't let that happen. Keep the pelvis nice and level. Now go ahead and stand up nice and tall, Janet. And now I'm going to ask Janet, how hard are you working? 4 or 5. So I can bring that up a little bit. Janet, I want you just to straighten your fingers. Nice. How hard are you working now?
About a 6.
So I brought it up. Now if I want to be mean and really push Janet, I want you to float your grip. So bring it off about 1/2 inch. How hard are you working now? See the wobble? That's exactly what you want. Now how hard am I working? I'm not doing anything. She's doing all the work. Isn't that nice?
Yeah.
But that's how it's supposed to be. And this is how you're going to improve balance. Good job, Janet. If you're working with a person one-on-one, I am with Janet, you have a couple choices on where you can be. I like to be in the front because it helps with eye contact. It's easier for me to keep eye contact with the person. You can also vary it up and you can stand and do something like this, depending on how tall the patient is, your comfort level. I recommend not sitting too long or standing too long. Variety is the key here. If you're taller, you need to stand toward the back of the device. So Janet, let's pretend you're 6'5". Notice the inclined handlebars. They're higher in the back, shorter in the front. So Janet, take a step forward. You feel good right there?
Yeah, this is fine.
As a quick resource, you can always use the cheat sheet, which is usually hanging from the device right here. The person's hands, they always need to be in safe position, which is just like that. Now to make it harder, and remember, we use the scale 0 to 10, rate of perceived exertion, or RPE. 0 means nothing, no problem. 5 means strong, this is hard. 10 means max, I gotta stop, okay? And I'm gonna ask Janet how hard she feels she's working as we go through these exercises. You ready? Great. First one, feet together. So go ahead and put their feet together. Make sure that the toes are touching, right? Yeah. You like? Yeah, the knees too. Now, go ahead and straighten your fingers because she looks pretty stable. Yeah, I like that. Now, how hard do you feel like you're working right now, Janet?
Maybe 5.
So she's working pretty hard right now. I'm gonna make it a little bit harder. Go ahead and look up as high as you can. And then now, float your grip. So she's gonna bring it off about a half an inch. How hard are you working now?
9.
She's at a 9, and then we count to 10. Great, or in this case, 3. Okay, now you close the grip, because I'm gonna do a new exercise now. Janet, go ahead and put your heel in front of your toe. So you go heel toe. That's right. Notice you always close the grip between exercises, right? And we go through the same thing. Now, how hard do you feel like you're working now? You okay here?
I'm fine.
Because the grip is closed, right? Now go ahead and straighten your fingers. How hard are you working now?
A little bit better. I'm a little harder.
How
Maybe-
hard?
Maybe 3 or 4.
About 3 or 4. I want to get her to 5 or 6. So now go ahead and look up as high as you can, right? Now how hard are you working?
Maybe 7.
That's as hard as I want to work. If I want to be mean, go ahead and float your grip. Keep looking up and then float your grip. And we're going to see a wobble. See that? That's a lot of wobbles. You still feel safe though, right?
Yeah, grab a hold.
Great job. Great. And I would count to 10. Next is the squat. And notice, go ahead and close your grip as we get into a new exercise. And feet set at shoulder width. Are you ready? Okay, now bend the knees just a little bit. And then now as you go down, try to keep your chest up like you're sitting in a chair. Keep more weight on your heels. And stop right there. I'm having her bend her knees to about 20 degrees. This is hard for a lot of people that don't exercise regularly. Now, you want to watch for the knees going in. Make sure the knees stay apart just a hair. It's really hard on the knees. And the biggest thing is, don't let the knees go forward. This is really common in chair aerobics, and it's really hard on the knee. Open your fingers. And now, how hard are you working now? It went up?
Maybe an 8.
Yeah, I'm not going to push her any harder than that, but if I wanted to, I just do a float grip. Good job, Janet. You're going to come on up. Now close your grip. Now the next one is called levitate, but we're going to do it with a knee bent. Janet, go ahead and put one foot up on here. Great. Notice she had the closed grip as she was doing it. That's safety, right? Now, how hard do you feel like you're working now?
Not very. 3 or 4.
Good. So what are we going to do? We're going to open your fingers, right? That's the next step. So we open the fingers. How hard do you feel like you're working now? She jumped to a 6. If I want to make it even harder, go ahead and float your grip. You're going to see a wobble now. Great. This is exactly what you want to see. Great job. Close your grip and come on out of it. Good. And you can count to 10 or 15, whatever the prescription is for that person. Last one, the 5th one, called cliffhanger. This is a big step forward, okay? So go ahead and take a little bit of a step back. You want to be all the way in the back of the device. And now, Janet, take a big step forward. Big. As big as you can go. Yeah, good. That's it. So she maxed out there. Now, how hard do you feel like you're working right now?
Maybe a 6.
She's already to 6 and she has her grip closed. So that gives you an idea of the challenge of this exercise just inherently. Now let's be a little bit mean. So Janet, I want you to just stop shrugging your shoulders, relax your shoulders, and now straighten your fingers. Keep looking straight ahead. How hard are you working?
7.
She's flaring her nostrils. She's working harder. Let's be mean. Janet, float your grip. So go ahead and bring, and now you're gonna wobble a little bit. But she's touching. She's perfectly safe. Great. This isn't gonna let her fall. as long as she keeps her hands in a safe position. Now, are you tired?
Yes.
Great, great job. Love it. Depending on what you want from the person, endurance or strength, motor control, you can get that just by altering the grip. So if I want more endurance and I want to increase the treatment time, but I want the person in standing, Janet, I want you to keep your grip closed and look straight ahead. And how long do you think you could sustain this? A while, right? And then I can put her feet together, challenge a little bit. But the point is, if I want a longer exercise time, I just keep the grip basically closed. If I want to start working towards strength and really taxing the balance system, the bones, the muscles, everything, cardiovascular, I'm going to go ahead and tell Janet, go ahead and open your fingers now. And then I can narrow the base of support if I want to. But I'm just going to leave her feet there. So that's a little bit harder, right? When you straighten the fingers. Now, if I really want to start getting after strength and make the intensity go up, that correlates with more of a float grip. So go ahead and float that. And now that is what you want to see. If you really want to improve balance, really improve strength, get dramatic changes in function, that is what you want. But you always want to ask the person, are you having any pain? Are you having any pain, Janet?
No.
And if you're having pain, especially with something like a squat, you want to make sure that if they are having pain, modify it quickly. It might be just as simple as not going down as far, fixing the knees, the feet, whatever, or just decreasing the intensity by changing the grip. Okay? Lots of variations. It's up to you to figure out what works.
S3 balance movements are based on medical research and biomechanics, and when done consistently, can improve balance, independence, posture, walking speed, endurance, mood, bone density, and muscle strength, while decreasing fall risk, disability, pain, blood pressure, medications, and depression. Before teaching or performing S3 balance movements, the movement library and instructor's manual should be reviewed. Using the innovative S3 balance verbal cues facilitate a safe and challenging experience regardless of ability. Of course, before starting any exercise program, physician clearance is needed, and while performing the movements, hands should be kept in the safe position to maintain balance. Pivot the device around to use as either a pull or push transfer aid. For a pull transfer, place one foot on the unit's base opposite the patient to prevent tipping. There's no need to stabilize the device with push transfers, and hands can be placed with both the patient's hands on the lower bar, both hands on the higher bar, or one hand on the lower and one hand on the higher bar. If the transfer is in preparation for gait, a walker can be placed inside the S3 unit. In preparation of stand pivot transfers, S3 balance is ideal for pivot practicing. Patients who are non-weight bearing on one lower extremity often have difficulty trusting a walker to provide enough support for them to pivot on one foot. S3 Balance's stability and protected environment is especially helpful with patients learning this skill. If the knee block is necessary, It can be provided from either the front or side of the device. Walkers safely serve one function: assistance with walking. In fact, walker users' manuals often state that they are not intended to be used as a support with exercise, since they are lightweight, have a narrow base of support, and will slip with lateral forces. The S3 Balance, however, has been designed to provide stability with standing activities and exercise. The S3 Balance provides a stable support surface for patients to stand, whether you're assisting with grooming, such as donning pants and hygiene with toileting, instructing patients in posture and normalizing center of gravity over base of support, pre-gait activities such as sidestepping with turns, instructing in therapeutic activities such as reaching with weight shifts or balloon toss, or of course any of the S3 Balance movements for balance training, strengthening, and stretching. S3 Balance weighs 57 pounds and takes about 20 pounds of force to tip. It can be moved with either the wheelbarrow method or the hand truck method. Walk the unit in front and slow down around corners for extra safety. Also, storing the units with the open side facing a wall can prevent unauthorized use. S3 Balance is a new class of transfer aid. For patients who need help with bed mobility but are unable to reach the railing at the head of the bed, S3 can be positioned sideways at an optimal level.
To train the upper extremity when using S3 Balance, we're going to use the loops. So what Ann is going to do, she's going to tie a couple knots in a TheraBand, and the green type requires 2 knots. The higher intensity bands do not. And she's going to feed the TheraBand through the loop, and now she's good. She's going to grab one end.
S3 Balance offers an accessory bag, foam cover for the stretching peg for sensitive feet. The bag clips onto the hooks, handle and ankle strap for elastic bands.
So a few takeaways. Number 1, if the patient can stand, please have them exercise in standing. Sitting doesn't compare. That way you can take advantage of all the benefits we talked about before. Number 2, take S3 Balance to the patient's room. It can help the patients get up, they can exercise in place, take advantage of all those benefits again. Number 3, watch the grip. Always start with a closed grip. Get the patient situated and then progress to an open grip, to a floating grip. You want to induce a little bit of a wobble. That means that you're working. Number 4, you want to make sure to contact us with any questions, anything at all. Email, phone, website, contact us. We're here to help.
For more information, you can check out the website, instructor's manual, one sheet, or email us. Thank you for listening to us. We really appreciate your considering a new and innovative way to help people who really need it.